penile implant is an erection assistance device used in the treatment of erectile dysfunction, or ED. A penile implant is placed inside the body during a surgical procedure, which in the majority of cases is an outpatient procedure. There are two major types of implants available, including the inflatable penile implant, such as the Coloplast Titan implant, and the malleable penile implant, such as the Coloplast Genesis implant. Both types are completely hidden inside the body and can create an erection at any time for any duration. The most common implant used is the inflatable penile implant. However, we will discuss which implant is best for you and your partner during our consultation together. The Titan inflatable penile implant is a 3-part fluid-filled system that is inflated to create an erection. The 3 parts are a reservoir that is typically placed in the lower abdomen, 2 cylinders which are in the shaft of the penis, and a pump that's located in the scrotum. The inflatable implant is designed to look, function, and feel like a natural erection. It is completely contained within the body. To get an erection, you or your partner squeeze the pump in the scrotum. Each squeeze moves some of the fluid that's stored in the reservoir to the cylinders which are in the shaft of the penis. As the cylinders fill with the fluid, the penis becomes fully erect. You can keep this erection for as long as you and your partner desire. When you no longer want to be erect, you simply squeeze the deflate button on your pump and your penis returns to a flaccid or soft state. For men who may have trouble squeezing the pump, such as those with poor hand dexterity, limited strength, or a range of mobility, a malleable implant might be the best option. This implant consists of 2 flexible silicone semi-rigid rods that are implanted into the shaft of the penis. With this device, when you want an erection, you simply position the penis up, and when you no longer want an erection, you move the implant into the down position. The Titan implant is made of silicone, polyurethane, and a material called BioFlex that is safe for your body and is stronger than silicone alone. The BioFlex material is a unique material specifically engineered for penile implants to make them stronger and more durable compared to other implants. The fluid stored in the reservoir of the implant is sterile saline. The saline is placed into the reservoir at the time of your procedure and cycles through the system on demand without needing to be refilled. Inflatable penile implants are a long-lasting solution for erectile dysfunction. Oftentimes, penile implants have an 80 to 90% chance of lasting 10 years or more. In testing, the Titan implant was shown to last more than 6.5 million cycles without breaking. In general, most men with ED may be good candidates for a penile implant. Candidates can include men who have tried and failed other ED treatments, or those who have had prostate surgery or other treatments for prostate cancer. Good candidates for a penile implant may also be men with pre-existing conditions such as those with cardiovascular disease or even diabetes. These men may not be able to take oral medications, or oral medications may not be effective. It's important to know that there is no requirement to try oral medications prior to moving forward with a penile implant. If you have poor dexterity in your hands, you may not be a good candidate for an inflatable penile implant, but we do have other options, such as the malleable implant. You are not a candidate for a penile implant if you have an active infection anywhere in your body, especially in the urinary tract or a genital infection. You're also not a good candidate if you're allergic to silicone or polyurethane. In addition, if you have problems with urination from the bladder, outlet obstruction, or neurogenic bladder, the penile implant is typically not an option for you until those concerns are resolved. I do address conditions such as those, so we can work on those conditions prior to the implant. Despite the durability of penile implants, you need to be mindful that your device may need to be replaced during your lifetime. If you prefer not to have a second surgery to restore your erectile dysfunction, you should consider alternative treatments to a penile implant. There are also some other considerations that we will discuss should you feel the malleable implant is the right treatment option for you. Please refer to this important safety information at the end of this video for additional considerations. We understand everyone's ED treatment journey is different, and during our appointments together, we will discuss all the options and determine the best solution for you and your partner. The penile implant is custom fit to your existing anatomy at the time of the procedure and is intended to optimize the length of your penis. During the procedure, I will measure the total length of your erectile tissue and place an implant that is the best fit and size for your anatomy. The implant fits alongside your existing anatomy. Inflatable penile implants are an effective solution for erectile dysfunction and have had high rates of satisfaction over the years, both for partners and for the patients. A study of Titan penile implant patients reported a 98% satisfaction rate, with a 96% satisfaction rate reported by their partners. Like any surgical treatment, there are potential risks with penile implants. These include, but are not limited to, device malfunction, such as break, leakage, infection, inflation difficulty, erosion, and incorrect sizing. Also, after a penile implant, it's no longer possible to have a spontaneous or natural erection, and most other ED treatments will no longer be effective. If you are able to orgasm, climax, and/or ejaculate before the implant is placed, these abilities should not be affected by the implantation of the device or the procedure itself. The inflatable penile implant is completely concealed inside the body. In the soft and non-erect state, the penis appears and feels natural, and no one can tell that you have the implant. Because of its nature as a flexible rod, the malleable implant is a bit different. The malleable stays firm when placed into the down position, and for this reason it may be more visible than the inflatable implant.